So today's session, I'm going to give you an overview of this award scheme and also the other NIHR awards that are relevant, because there's been some changes this year for people who are hoping to build a research career. We're then going to welcome Deborah. Thank you, Deborah, for coming. She's one of our current SPARC awardees, and she's going to talk about some work she's been doing with North Thames ARC and building her networks there. And then we've got a bit of a chance at the end to have some questions and answers. Brilliant. So today I'm going to talk mostly about the SPARC Awards and go through the particulars of the scheme. And I recognise a few names here in the group today that certainly would be eligible for the SPARC Awards. So that's really nice to see. So the SPARC stands for, and this is going to test me, Short Placement in Applied Research and Collaboration, I think. But anyway, it's a placement basically. And it's an award that allows people to network, to train in a specific skill or collaborate with other researchers or specialists. And it's really designed as part of their career development pathway to optimize and enhance an individual's training so that you can build your CV and progress your academic career. So the SPARC Awards are really nice small awards. Now there's 3 different streams or methods that you can apply for a SPARC Award, and this is where it's just slightly a bit complicated about eligibility. So the main stream is what they call the SPARC Award, and this is for NIHR Academy members, and I'll come on to talk about who is an Academy member in a moment. But that green box there, which is the main SPARC Award, gives you up to £5,000 to do a placement in another part of the NIHR infrastructure. So you might go to another ARC, you might go into other types of infrastructure like the BRCs, so the biomedical research centres, and there's lots of other options, and I'll talk about that a little bit more in a moment. About 2 years ago, they also added this new stream called the LA SPARC, LA standing for local authority. So this scheme is a sort of two-way scheme allowing researchers to have placements in local authorities, but also local authority employees to do placements in academia. So that's why I've got 2 separate boxes. The scheme gives you the same amount of funding, so if you're in either of those categories, you get up to £15,000 to develop your networks and do a small piece of work. So just to summarise, the blue box is for local authority employees, and they can come and do an academic research placement, or an academic can go and do a placement in a local authority. So what do we mean by an NIHR Academy member? So these are people who hold NIHR awards that are developmental in nature, so they're about your career development. So certainly senior investigators, research professors, but anyone in particular on a fellowship program. So if you're on a PCAF, or you're on the pre or post-doctoral or advanced fellowships, then you are certainly an NIHR Academy member. And then if you are associated with ARC KSS, if you're associated with any of the NIHR infrastructure, you are also an Academy member if you fulfill the 3 bullet points I've put in bold. So if you're undertaking a formal training or career development award, and that we can discuss with you if you're unclear, if you're eligible under that. But if you're as closely associated with the ARC, if you're funded by the ARC, then you certainly have a training plan. And you receive at least 25% of your funding from the ARC. Now, that can either be directly from the ARC or from one of our partners as co-funding. So for those of you, and I see a few names, Sophie, for example, you're on one of our embedded researcher fellowships. So you certainly classify as an NIHR Academy member through the funding that you're gaining for your project. And you must be hosted in a setting for research capacity development, but that's a given if you're associated with the ARC. Good news as well is that our postdoctoral researchers who are working within our themes are also classified as NIHR Academy members. So if you're at all unsure about that, please do drop us a line and we'll discuss your eligibility with you. So for the SPARC, where can you go and what can you do? So there is a full guide on the NIHR website, and we'll share these slides because the links you'll be able to click through. And it's a very long list of all the possible places you can go and get some research experience or be immersed in someone else's research culture and environment. And what sorts of things can I do? So it's about developing skills. It doesn't actually have to be a project, and a lot of the time it's not a distinct project. It might be about developing skills or going and learning from someone else who is an expert in the field. And it can be a bespoke program. So you suggest what it is you want to do. It can be used to build links and knowledge in other parts. So to build your networks and gain the expertise that you think you need to progress your career. You can go and experience research if you're coming into academia, or practice if you're going the other way. So you might want to go into a local authority and find out how they do a certain type of care, for example. So you can spend time on the placement in a local authority or commissioning service setting. You can develop partnerships and joint ways of working. So that's particularly quite nice for the local authority scheme, because you can develop those relationships with a practice partner or a care partner. And you can also explore the issues and challenges faced in the care sector, and that might influence then or give your projects a bit more of a real world setting. You understand the challenges that people are facing in provision of care, and you can build that into your project. You might just want to go and share knowledge and experience or co-create research connected with practice, as I said. So it's very much about trying to look at things from different perspectives. But I like the little cartoon in the corner. You know, it's about sharing different ways of looking at things. And a lot of the time there is that tension between academics who have a research, we do things in a certain way in academia, but it's very different in care and practice. So it's nice to experience and understand those different contexts and different ways of looking at things. At the moment, NIHR have their highlight areas of interest. So they're particularly interested in multiple long-term conditions and industry or commercial sector placements that are relevant to that. So some of the practical bits. So the funding limits there. So the SPARC, which is the NIHR Academy members to immerse themselves in another part of the NIHR, is £5,000, and the time frame is dependent on your activities, but a year is not unusual, 6 months to a year. The local authority SPARC is a little bit more because it allows you to pay for some of the local authority relevant costs. So maybe a supervisor in a local authority, and to allow you to go and work with them without cost to the local authority. And how do you apply? So the call is generally advertised in the summer and autumn, so we're a little bit ahead of the game so that we can highlight this to people and you can be prepared for the release. If you're hoping to do a placement within ARC KSS, you need to contact us because we need to actively help you with your application and do a statement of support as your host. But we're also more than willing to help anyone with a SPARC application in the region. And the application system is the NIHR ARAMIS system. The application form is not onerous. It's quite, and Deborah can hopefully, give her experience on this. It's quite a nice application. It's not too detailed, has some of your common things around a summary of your placement information, CV, contact details, overview of your experience. And then it just asks you to outlay what it is you want to do. So your proposed title, start date, length, what your plan is on the placement, and also a little bit about why. Why should they fund you to do this placement? What's the benefit and the impact of doing this work? You will need a statement of support from your supervisor. Everyone does need a named supervisor wherever they're going, and a budget, and then sign-offs from your local organisation. A little bit again on timelines. So as I said, this normally opens in late summer, early autumn for applications. So check your eligibility, have a read about it now if you're interested, and you can always get in touch with us if you're interested in the scheme. And I've put the links in there for the full scheme details. So just as a few examples, and Deborah's going to talk about her placement, which is the last one, shortly, to give you a bit more information about what it's like. But we've had 4 or 5 of these placements over the last couple of years. So we had one of our PhD students did a placement up in North Cumbria, and their project was around commissioning for a particular condition and policy work around that. So they wanted to understand commissioning perspective from another region to give their project a little bit more breadth. So they got funding to do a 1-month on-site placement. So they went up and stayed in a hotel and worked intensively with commissioners up in the northeast. And that really helped them learn and link and give a bit more breadth to their project. We've also had a local authority employee come and do a placement with ARC KSS. This was a teacher from London who worked on virtual school provision. She came and worked with an academic in Surrey, at the University of Surrey, I think, to build her skills in research, because she was aiming to then apply for a doctoral fellowship, which she has now got. That was really fantastic and really helped her to get some time and sort of input onto her work and application. We've also supported a public health consultant to do a placement within ARC. Again, they wanted links with academia, and they worked closely with an academic at the University of Brighton to do an evaluation within her public health role. So that person did do a bit of a project, but also built skills along the way. And she also wants to move on to do doctoral research. So there may be some people in the audience for who now may not be eligible for those SPARC awards because they're slightly nuanced, but there is something for everybody in the NIHR to help develop your skills. So I just wanted to highlight some of the other training opportunities that might be of interest. So obviously the SPARC awards I've popped in the orange box, but new this year, the NIHR have actually opened up their Development and Skills Enhancement Award. And this is now open to all postdoctoral researchers. So you don't have to be an NIHR Academy member to apply for this funding stream. And this is also clinical and academic researchers. So there's no distinction. The only caveat is that you have to be postdoctoral level. And they're keen to support early and mid-career researchers to gain skills and experience. So they're up to £5,000, includes some salary award and conference and mentorship skills costs. So it's really nice opportunity. And they're particularly interested to see applications from areas of health data science, clinical trials, anyone who's interested in entrepreneurship and working with industry, those starting on their academic career or returning from a career break. So it's a nice option for people to think about. And then also in the green box, I've put the 2 fellowship programs, which are also a good way to get on the ladder and get training in research. So for those, we've got the ICA, the Integrated Clinical Academic Program. So that's for non-medical, so non-doctor or dentist professions. And the local authority academic fellowship is for those in local authorities. So there's different levels from the internship, which there are opportunities at the University of Kent for the internship and will be at the University of Surrey and Brighton coming up shortly. And then you can move on to pre-doctoral, doctoral and more advanced fellowships. And for anyone else, if you're an academic or if you're a clinician or a dentist, it's the NIHR Fellowship Award Scheme, which has the same sort of structure, pre-doctoral, doctoral and advanced. So as I said, we're here to support you. So if you're interested in any of the opportunities, or if you just want to have a chat about a research career or get some links and support, this is the Academy team. We're led by Sally Kendall as the Academic Career Development Lead, as myself, and Debbie, who does all the day-to-day and is the foundation of the ARC KSS Academy. So do get in touch with us at arccacademy@kent.ac.uk, or you can visit our website. And I'll hand over to Deborah to tell us about what she's been doing in her SPARC award over the last, I guess, few months. You may be in the middle of it, I think.
Yeah, thanks, Mel. Yes, I actually just started last month, so I'm just about a month into my SPARC award. And Mel, when you're trying to explain SPARC, I think I've also been trying to remind myself what SPARC means. It sounds like a very fanciful word, but I mean, the full meaning, short placement award for research collaboration, and it's very easy to kind of get that mixed up. So my name is Deborah. Most of you on this call would have met me or know me already, but and for those that don't, I'm the Post-Doctoral Research Fellow for the ARC KSS Primary and Community Health Services team. I'm based at the Brighton and Success Medical School. And yes, today I'll be sharing my experience about this SPARC award. Because I'm still quite early into the award itself, I'll be focusing more on the process and the kind of thoughts that went into applying for it. So just to start a bit about myself, because I always feel it's an important place to start when I talk about my research experience. I've kind of started from an interesting point. I did my BSc in aquaculture and fisheries management back in Nigeria, and then I went ahead and did a master's in sustainable planning and environmental management, because that just seemed to follow on nicely for my BSc program, and that was in Hertfordshire. I did my thesis, around evaluating stakeholders' views on a town center redevelopment project at that point. Then after that, I wanted to do public health. So I thought about what kind of public health program I could go into. I tried applying for a couple before then, and I didn't get accepted because I didn't have a clinical background. So I applied and I got accepted for a MA in public health program at Nottingham Trent University. And that program was quite interesting because they focused more on the social model of health, teaching more around the social determinants, more health promotion based and less on the clinical aspects. And I think that actually was perfect for me because it's actually built on my past experience and also that environmental management experience I've had from my previous degrees. So for my MA Public Health, I had an interest in breast cancer research. So I did my dissertation trying to understand the perceived barriers to access to breast cancer detection services for African women. And I focused on Uganda as a case study. And I used one of these health promotion theories called the socioecological model of health. Finding off from that, I think my master's, my master's work was very, very in-depth, and my findings were actually very rich. And I built on that to do a PhD, having found out what the issues were. I built on that to do a PhD around, how to take a health promotion approach to strengthen the primary care system to facilitate any breast cancer detection. So I've kind of focused a bit on this because I think as I go on, I would explain why the SPARC award, why I went for the particular project I went for, and how that complements my background. So just, I won't really focus on the SPARC because Mel has done a very great job of explaining, what the SPARC award is and what it enables you to do. And I've just, again, highlighted here what Mel already talked about, it's having two focus areas, one around multiple long-term conditions or multi-mobility, and then the other one being around industry or commercial sector. So I went for the first stream of work. I applied under the first stream, which is about multiple long-term conditions. And the title of my project was to build research capacity for health promotion interventions to support the management of multimorbidity. And, I just put this diagram here because one of the things I really highlighted in my application is the fact that multiple long-term conditions is timely, it's national priority. It is estimated that 1 in 4 adults in the UK actually are living with 2 or more conditions at the same time. So it's very important during the application process to show how your project aligns not just with the NIHR focus area, but with national health priorities as much as possible. I think that's link, one of the feedback actually I got from the reviewers that reviewed my application was that the fact that I was able to draw the clear link to national priorities. So I drew the link to the core 20+5 because again, I was focusing on Black Africans and I highlighted that health inequalities aspect. So they liked the fact that I was tying my application back to what the UK actually have identified as being relevant focus for the healthcare system. And the purpose for the award, and I've just put this in the way I put some application, is to develop my skills and have that practical experience on how to design or implement health promotion interventions that can address multiple long-term conditions in Black Africans. And even though I've done health promotion research in the past, one of the things that I highlighted is the fact that I've not done health promotion in the UK. And obviously there's bound to be that contextual differences from the health promotion research that I've done in Uganda and the one that I really want to learn about in the UK. So why I applied for the NIHR SPARC award, and my rationale really was to complement and build on my existing skills and experience to propel me towards that career development. My own personal career goal is to establish myself, as a global health promotion leader. And I thought this SPARC award would be a kind of help me towards that next step, towards building that capacity. Having gained health promotion research from my work in Uganda, from my MA and PhD work in Uganda, and not really being embedded or having that hands-on experience on what health promotion looks like in the UK or how it is practiced in the UK, I felt that having this SPARC award would actually complement, that international experience, giving me that national experience and helping me to become more rounded and, in the end, contributing towards my own career aspiration of being a global health promotion leader. So again, this is just my research journey that I've already talked about on the first slide. And this actually, I was able to articulate this clearly in my application that I've done an MA public health using health promotion lens. I've done a PhD public health using health promotion lens as well. And also as part of my postdoctoral research work in the primary and community health services thing for ARC KSS, I've also started looking at the links between physical and mental health conditions. So the interactions of 2 health conditions in an individual. And at the time I applied for this award, I was just completing the systematic review of the risk for poor mental health in cancer patients. Again, I tried to draw out that health inequalities aspect from that systematic review, and I made it clear in my application that I was doing this work. And getting the SPARC award during this project would then take me towards that next step. Having done this past work would take towards the next step of getting that national experience, having that practical experience of multiple long-term conditions, especially for Black Africans, and why that is important. So in deciding my host institution, I also think this is also another critical part of the application because it's very important to show how your host institution or your host ARC complements or offers something that your current ARC is not offering. And actually, Mel, that's one of the questions that Mel also posed to me is, what does the ARC North Thames have to offer that the ARC KSS would not offer you? And that really got me thinking. So before I applied for this, I attended the ARC KSS networking events that we had in London last year, September, and that was a face-to-face event. At that event, someone from the North Thames, actually the academy lead from the North Thames ARC, who is Professor Angela Adeshi, presented on one of our research around maternal health in Black Africans, and she was talking about using a health promotion approach. And that really piqued my interest because that was, for me, that was like the first time I would really see health promotion in action in the UK, like having that feel for what it looks like. So I had a chat with her after the networking events then in September, I didn't even know about the SPARC award, and I just had a chat with her and told her about my interest in health promotion, and I would like to link up with her. Then when I saw the SPARC and I thought I would like to actually build on my health promotion experience, I thought she would be the ideal person. And I read upon her profile and actually saw that she's got a great reputation, in delivering complex interventions. And just realized that one of the key things about health promotion that makes it a bit different from other interventions is that it focuses on these multi-level approaches. It goes beyond looking at individual or looking at promoting individual behaviors, but it looks at it from a whole system. So individuals, healthcare providers, the policy perspective, looking at interventions that actually speak to those different areas of, overall, the outcome would be to have improved and sustainable health outcomes for people. So Professor Angela is based at the University of London. And when I looked at our department, again, I saw that they were offering things around social determinants of health. They were looking at addressing health inequalities, which is also the same for the ARC themes. And one of the things that the ARC themes, one of the things that really stands out in terms of what the ARC themes offers that is different from KSS is KSS is quite diverse, but that diversity is actually based in one region than the other. Whereas in North themes, which is around the London area, they actually have more access or more engagement with ethnically diverse population. Here we still struggle to engage with Black Africans, with people from other ethnic groups. But in the North Thames ARC, they already have that established connection. And that's one of the things that I liked, that being able to work with Professor Angela and being embedded with the North Thames ARC would give me access to engage with that set of population that I don't normally get access to in my own ARC. So for my ARC activities, what I'm doing is, like I said earlier, I started in May, and I'm going to be working on this project for the next 5 months now. I've proposed it as a 6-month project. And the plan is I work one day a week for the next 8 months. And really what the SPARC award covers for me is travel expenses to London and to different sites. So for instance, I've been shadowing Professor Angela, one of our projects, which is around a UKRI funded project on building aware communities. And they've been engaging, having World Cafe events in Otford area in London. And so I've been attending that event and supporting them to facilitate some focus groups, at the same time building connections with some community organizations, and understanding and just seeing how they really engage with people differently and learning different ways of engagement. So I've proposed 5 activities under my SPARC project, and the first one is to register a systematic review. Not to do the systematic review, but just to register the protocol. And the point of this protocol is to look at the effectiveness of health promotion interventions to address multiple long-term conditions in different populations. So what I plan to do is to actually review other systematic reviews that have looked at health promotion and multi-mobility. But the second part is to engage with existing research projects that is being led by Professor Angela. One of those ones is the UKRI funded project on the building aware communities. Then she's got the funding just about a year or so ago. So it's still a quite new project. They're just in the early phase of engagement. And that actually is very important. That actually suits me well, because then I can, follow through and support with some activities as they're setting up the project itself. Then the third idea is to build collaborations with the existing North Thames ARC partners or organizations, as well as local communities as well. Like I said earlier before, the North Thames actually offer access to a more diverse population than the KSS does, and that is quite important. And also, I plan to do some initial consultations with Black African communities in London to start getting some views and some ideas around, one, what do you understand as multiple long-term conditions? Because one of the things I've also understand is for health promotion, it's very important that you're on the same page with the communities that you're working with in terms of language. What we understand as multi-mobility or multiple long-term conditions might not be the same as what the communities perceive or understand as multiple long-term conditions. So the starting point is first to understand that do we share the same understanding of multiple long-term conditions, and start to get some initial feels on how they feel that multi-mobility or multiple long-term conditions should be addressed amongst their population. Again, it has to be culturally relevant to them. Then lastly, I'll be undertaking some research training programs being delivered by the Epicenter, which is the Evidence for Policy and Practice Information Center. So training programs like meta-synthesis, conducting umbrella reviews, research engagements with different populations. So all of these are being costed and within my SPARC award. So I've already started on one and two now. So I've started on the protocol and I'm already engaging with the existing research that Professor Angela is leading on. So I would just like to focus now on the application process and how it was for me. This might be different for different people, but this for me was like the process and what I did in terms of applying. So yes, I had an idea already. I had an idea that I wanted to build my earth promotion capacity. And then luckily for me, actually, I already found a supervisor, a potential supervisor at the time whose skills and experience complement mine. Then as Mel talked about, I actually can't overemphasize this enough. It's very important to contact the ARC KSS Academy for support as early as possible, because for me, I think I would not have been able to apply if I didn't have their support, and not just their support in terms of them speaking to me to help me fine-tune my ideas and help me to think about the critical areas, but actually support in terms of linking me to that host supervisor, because the supervisor needs to sign off on the application before you can actually submit it, and getting the supervisor on board, initiating contact, sharing your proposal with them, having them review. And for this SPARC award, the supervisors are not being paid for their time. So actually it's a good real heart on their part, and getting someone who has the time to commit, within that short timeline for the application is very important. And this actually is where the KSS Academy were very instrumental, and they supported me because they linked me with the host supervisor. And for those of us based at universities as well, it's very important to inform your research office and your current supervisor, so your current team lead or your current manager, because your current manager also has to sign off and approve the application. The way the SPARC award is that it lets you buy some time out of your current role without actually buying the time out, in the sense that you are still being paid full time for your current role, but then you're spending some of that time working in a different institution. So there needs to be an agreement or discussion agreement with your existing manager that they're okay with the arrangement, and they also need to sign off on the online application form before you can submit, as well as your research office as well. Your research office has to sign off on the application form before you can submit it. So it's very important that you engage them as early as possible. Then I just went to draft my proposal, different versions, and sharing it with different people for their review and their comments. Then completed the application form on the online system that Mel talked about. I got the pre-approval, so pre-approval from Sally, who is our academy lead, pre-approval from my host supervisor, who is Angela, pre-approval from my current supervisor, who is my team lead, then and the research office, and then I submitted it. So in terms of a timeline, I also think it's very important to show what this means in terms of timeline, because there is just about 2 months or about 3 months, 2.5 months between the time the call opens and the time you have to submit the application. So really, there isn't much time to get all of this done if you don't have the process already thought through in your mind. It can just become delayed, and then you'll be able to submit it. So for the last year round, which I went for, the application call was open on the 28th of September. And Mel, I remember that on the 30th of September, we had a briefing session where you talked about the SPARC and the early SPARC, and you asked that anyone interested should contact the academy, which I did on the 4th of October. Then the 20th of October, I reached out to the ARC KSS Academy again to link me up, with the supervisor, since she's already an academy lead for another academy. I think Mel actually suggested that it would be better if Sally should initiate that contact for me first, just to ensure that I get quick response. And again, that was a good move, because I think if I contacted her on my own the first time, she might not have responded as early as possible, again, given that she has a busy life, busy schedule and the rest of it. So I submitted my application on the 23rd of November, deadline was 24th. I was really aiming to submit before the deadline, just in case anything happens on the last day. And the deadline was 1 p.m., actually not the end of the day, it was 1 p.m. on the 24th of November. Then on the 3rd of March, I got an email that my award was successful, which was obviously the eureka moment for me. And I started my project on the 1st of May. So even though I'm quite early in the project, I actually can see some, emerging outcomes. And I really didn't want to put too much details on this slide because some of them have not been confirmed yet, and I think Mel knows about some of them. So one of the benefits for me has been that confidence boost. I think being able to get any award really builds your confidence as an early career researcher, because it just makes you feel, if I can get this one, then perhaps I can't get the other one. And it also makes you feel that your idea actually is valid in a way, and it is also clear. People can see the value of your idea and they are willing to support it. So that really boosted my confidence that I got this award. And it has also been expanding my professional network. So for instance, I've been linked in with the ARC Thames multi-mobility team, and I attend their weekly meetings. So I'm already making links and getting to understand people who do research around multiple long-term conditions, the kind of research they do. And if I do want to actually apply for, a future grant, then I can start thinking about who would I want to collaborate with and who would I want to reach out to either support or be a co-investigator on my grant. Then one other thing that has actually already is emerging is this new cross-ARC collaboration with the London School of Hygiene and Tropical Medicine. Because even though I'm linked with Professor Angela, who is based at City University, the fact that I'm already embedded within the North Thames ARC gives me access to the other members and other universities, and one of them is the London School of Hygiene and Tropical Medicine. So we've been trying to implement something called the Friendship Bench in our region for a while now. I've been speaking to this with my team lead for a while now, and interestingly, when I got this award, I realized that actually the people who are the directors or who established this concept of the Friendship Bench are based at the London School of Hygiene and Tropical Medicine, and that also happens to be within the North Thames ARC. So one of the things I've been doing is, having face-to-face meetings with them and exploring areas to collaborate with them on that project, and seeing how we can have a cross-ARC project between, well, this would be more of a cross-institutional, but in the longer term, it's a cross-ARC because it's still under the North Thames ARC and KSS. But at this point, we're thinking about a BSMS and the London School of Hygiene collaboration on the Friendship Bench project. And also connections with local organizations. So far I've attended 2 events, 2 world cafes, to support Angela with our project, and already I've made some links with some Black African organizations and some voluntary sector that work with marginalized populations, some that support 2 different interventions. And one that was really interesting for me, actually, I would just say that is there was this person I met who works for the DLR in London, the DLR Real Network, and they actually have a community engagement department where they support people who want to do research with seldom at population. So they provide free transport to areas along the DLR routes. So if you want to take people to, say, from I don't know, East London to South London, and you're going to take the DLR route, for instance, you want to take them to visit a park or take them to a theater for an arts event, they would provide free tickets. So having that kind of information and those kind of links already, start thinking about creative ways of even engaging with non-health sectors. So that's the transport sector, and understanding how they contribute to health. Our health interventions is very important, and being able to build that kind of connections or know how to engage with them, again, is very fundamental to my research. So just to summarize now as I close, I think I'm a bit over time. To summarize, I've just put in here like a takeaway, like take-home point in terms of applying. Again, seek support from the ARC KSS Academy as early as possible. Let them know that you intend to apply. Let them know what your project idea is about, so they can advise you appropriately and also signpost you to anyone who might be able to support. And it's very important to show how the SPARC complements or builds about. It is more of a research development award. So it's more about building your skills, and you need to be able to articulate that this award complements my existing skills, or it builds on in this area. And then, aligning your proposal with, national priorities, NIHR objectives. Like I said, one of the feedback I received was the fact that not only did I focus on one of the objectives of the NIHR but I also tied it to national priorities around multiple long-term conditions, around the core 20+5, and that actually was one of the feedback I received as a positive feedback. Yes, but keep it simple. It doesn't have to be complex. I think the simpler it is, actually, the better and easier it is to communicate your plans to others. And also provide a clear rationale for why are you applying, why now, what is the value, because you need to be able to show that your idea is sellable and, you know, show value for money, essentially. And also being able to articulate the reason for choosing the ARC that you've gone for, the host institution and your host supervisor. How would they support your career? How would they complement, you know, your skills? And again, one of the feedback I remember now I received from awards is the fact that one of them said, actually, Professor Angela is a perfect supervisor for the project that that I've proposed. And so being able to show that your supervisor's, you know, pathway is aligned with yours as well, and they can support you with your career aspiration. Yes, time management is key. It's very, very key. The earlier you start, the better. It's also important to start engaging with your supervisor as early as possible, because they need to be able to sign off your application before the deadline. Aim to submit 48 hours before, then don't leave it to the last day. I aim to submit 48 hours before, but I submitted 24 hours before, which was still good. The day I submitted, I was almost like to panic because Angela was supposed to sign off for me to submit, but she couldn't sign off the day before. And I was checking the time, like, okay, Angela, please respond to my emails, respond to my emails. She signed up around 3 p.m. on the day before the deadline. But imagine if I left it in the last day, she wouldn't have been able to sign up. And she can't sign up until actually I've done my part. So I need to fill the form and complete my session before she can upload our own statements of support and then sign off. So again, it also depends on how early you're able to complete your own session, because if you don't complete it, others can sign off on it. So it's also important that you do you do your own part as early as possible. And yes, prepare different drafts, first, second, third, fourth, fifth. You know, the more drafts you prepare, the stronger your application becomes and the clearer your ideas are communicated. And also there is a word limit actually on the application form. Think about 500 words or so, I can't really remember, but there is a word limit. So again, the more you refine your draft, the more you're able to keep within that word limit without losing the message of your proposal. And yes, keep everyone updated. When you are done with your form, send an email to those who are important or those who need to sign off, the KSS Academy team, your host supervisor, your correct manager, your research office. Let them know that you've done your part, and keep chasing people up as early as possible if you notice that people are not doing what they should be doing. I think the issue with this system is at the point of application, it should not update you when someone has signed off. You need to go back in, you need to keep logging in to check who has signed off, whose signature is pending, whose approval is pending. So just to be aware that you may not get that alert once they sign off. So just have that back of your mind to keep checking in. Yes, I think I would like to end on this note and to say thank you to everyone that supported me. Thank you, Mel. Thank you, Debbie. Thank you, Sally. And thanks to thanks the ARC KSS Academy team as a whole. And thanks to everyone for listening.